Greetings. I'm dressed this way because I have a dental appointment in about an hour. Going to have my very first root canal. I'm not happy about it, but you don't dress up to go to the dentist. You also don't dress up to go to the doctor. And if you looked and you saw the thumbnail, you're going to see that there was an amount there for around $275 that I had no expectation I was going to be getting. Back in August, I had a physical. Now, I've been in healthcare 35 years, so what I did up front, when I called the office, I said, I'm having a physical. I know the physical is covered. How do I know that? Because I've called the insurance company. And I said, okay, I'm having a physical. Is it totally covered under insurance? She said, yes, the physical is covered 100%. She said, however, if they do some other things, they may turn it into a diagnostic visit. To which I said, well, no, I'm not doing anything else. I'm just going in to have a physical. So I made the appointment as a physical. And I talked to the insurance company. Now, here's something that I did that at the time I didn't think this was a mistake. I've been going to this guy for a long time. He's a good guy, but I've been going for a long time. I just listed other things that had been going on with me because I figured he was probably going to ask me. So I just had them on a list so that they were there. And so I get there, I wait for him to come in, he comes in, I said, okay, this is just a list of other things. So he does the physical, does everything that's supposed to be done, yep, everything. And then he looks at the list, and then he just asked me a couple of questions. And he said, well, you can do this for this, and do this for this, and do this for this. Okay, fine, we're done. Maybe between 10 and 15 minutes. If that, for the physical, everything else. I don't even think it was that long. Most of the time when I've seen him over all these years, most appointments have only lasted about 5 minutes. This one may have gotten to 10 minutes. I don't think it did, but anyway. So then he says, well, you have to have lab tests done. Now, I'm wondering, okay, are the lab tests part of the physical? I don't know. Truthfully, I hadn't had a physical since 2012, so I just didn't remember. And back then, I had a different insurance where it didn't matter what I had. My copay was $15. That was good. So I let the lab work be done. And so then I get this bill for $275, and I call up and I speak to the lady. I said, okay, so tell me about this. I came in for a physical. I said I was coming in for a physical. How did this turn into a diagnostic visit? And she said, well, we did do the physical, but he recommended that you get this thing, and he recommended that you do this, and you had lab work. So it became a diagnostic visit. I said, I didn't know you could have a physical and a diagnostic visit on the same day. I didn't know you could bill for both of those. And she said, well, yeah, we can. So then, this is me, and now we're going to get it in the coding. I said, how did it end up being a 99214? That's a pretty comprehensive thing. This wasn't comprehensive, especially since the physical was done first. And the way it reads in the manual, because I have the manual, it's supposed to be at least 25 minutes. It wasn't anywhere close to 25 minutes, even if you include the physical. And she says, well, I'll have to take this back to the doctor because he's the one who coded it. I'm thinking, okay, you know what? Take it back to the doctor. 99214 is a bit extreme. And, oh, by the way, where is the physical? I don't see that charge on here. Oh, well, that's covered in full, so we don't send those out as a statement because it's covered in full. So I said, so in other words, I can't get an itemized account of everything that I had done. Oh, we can send you something separate. Yeah, send me something separate. I'd like to look at it all. I've been in this a long time. I'd like to just see what I have. So as you can tell, I'm a little irked. And here's my thing. I have talked and I've written about this concept of transparency, that it has to be out there. Now, I thought I did my due diligence in calling the insurance company and asking if this was going to be totally covered, and then talking to these folks. During the conversation, she says, well, we sent you paperwork. So you didn't send me any paperwork. No one ever sent me any paperwork. We didn't send you paperwork? No. It was a physical. No, you never sent me any paperwork. So I guess the paperwork, if they'd have sent it, would have told me this other stuff. I wouldn't have bothered because I'm just thinking this is something they do. You know, when I go to see my diabetes doctors, they send him stuff. When I go see the eye doctors, they send him stuff. So I'm just assuming that, you know, this is a guy I've been going to, this is 2018, I've been going to for about 16 years. So I'm thinking, you know, we've got this kind of symbiotic relationship. We're doing well. We understand each other. This here, I didn't really understand. So I got this bill here for $275. It's not super, super outrageous, if you want to know the truth. I've gotten bigger bills from my other doctors. But it's just the idea where I'm sitting there thinking, wait a minute. I went into this thinking it was going to be totally covered, and it wasn't. So I can give this bit of advice based on my own little personal experience here. If you are going for a physical, and you know that, and you talk to someone, you need to ask them, okay, what constitutes a physical? At what point will it not be a physical anymore and turn into a diagnostic visit? At least I got lucky in that they didn't try to charge me as a new patient since I hadn't seen him for a few years. But really, come on, 25 minutes? We weren't in there 25 minutes. Trust me, we've never gotten to 15. I'm not sure this got to 10. It's just something to learn. Anyway, my little rant. My name is Mitch Mitchell. I hope y'all have a wonderful day. I hope you've learned something that may help you in your healthcare pursuits. Talk to y'all later.